Good morning, everyone, and welcome to a new Connect University session on the digital decade. Today, we will focus on how the EU's digital transformation can have an impact on the healthcare domain. This Connect University session is part of a series of sessions focusing on the Digital Decade Policy Programme. Last time, we focused on how the EU can help boost, for example, advanced digital skills. And the next one is planned for September. We will again focus on this aspect of health, this time on how digital tools can have an impact on mental health and the importance of the EU's regulation. So as I said before, today we will focus on the EU's digital transformation and the impact on healthcare. So maybe the first image that comes to mind is science fiction movies with robot doctors or flying ambulances, but we're not there yet. The progress, however, that we have made is nothing short from revolutionary. Now, the digital transformation is not about adding new technology just for the sake of it. It's about rethinking the way we deliver care, the way we access, use, and share health data. All this to make healthcare more accessible, more transparent, personalized, and also more secure. So just before introducing our speakers of today, just some housekeeping rules. Thank you to everyone who has joined from Slido. I remind you that you can use Slido to post your own questions, and we will have a Q&A moment after the presentations. We will try to address most of the questions, but of course, those that remain unanswered, we will get back to you in writing. This session is recorded. We will post the recording on our YouTube channel and on our Futorium, along with the writing of the questions that we will answer. I will be moderating this session with my colleague Eline Chivot, who is in the room today. And now, without further ado, let me introduce to you the first few speakers of this session. We will listen to a number of presentations, the first one being from Eric Peters, acting head of unit, and he was acting head of unit of the unit dealing with the Digital Decade Policy Programme coordination. He will set the scene on the digital decade and tell us where we are on that. This presentation will be followed by Saila Rinne, acting head of unit for the unit dealing with e-health. She will set the scene on health data, and then followed by Renate Palen, who is policy officer in the same unit. She will explain a bit the logic of the e-health indicators and the important added value it brings to citizens. And this will be followed again by Maya Madrid, policy officer in the unit dealing with e-government. She will tell us a bit about the importance of e-identification in the healthcare context. So Eric, the floor is yours.
Yes, thank you very much, Lavinia. It's really a pleasure to be with you this morning with the best experts of the European Commission on how digital transformation can revolutionize our healthcare system, our health, and also, more importantly, not just the potential of it, but how concretely we can make it a reality for people now. So not thinking on, in a decade, but really now. And this is, one of the lessons that you will, I think, learn after this session, after this morning, is that the success of this endeavor is relying on many actions in very different activities. So we need skills, we need security, we need the data spaces, we need the regulations, we need cooperation. And to introduce this session, I think it's important to remind ourselves the overall strategic framework in which we are coordinating all these different activities all together, because the success will be decided if we coordinate all these different activities. And this plan, this coordination of activity between Europe and member states on the ground, is currently being called the Digital Decade. And I will, in the next minutes, present this Digital Decade framework. But before that, I'd like to say that this initiative came from a wake-up call. And a wake-up call that is really fitting very well with this morning discussion, which is the COVID crisis. Because the COVID crisis has shown that digital transformation is essential in our lives. I mean, there is no way you can today connect, work, study without digital technologies. It also shown that digital can help health. I mean, we all have had the personal experience that with the COVID certificate, with the tools that we had on our iPhones, we could not only move across Europe, but also be certified to make sure that we were vaccinated. So in a sense, we had in the COVID crisis the clear demonstration that together, with the right technologies and with the right tools, digital can help. The third element, which was very important and triggered by this crisis, is the need for Europe to upgrade its plan. We have had digital policies for a decade before, but this COVID crisis has shown that we needed to upgrade our actions. We need to cooperate much more because we were not up to the standards we would like to have in Europe for making sure that digital technologies can serve people and their lives. And the last thing, and it is something that you will see in the various presentations today, the last critical element is the need for addressing all issues altogether. There is no way that we can succeed without the skills, without the security, without the data spaces, without the regulation, altogether to be addressed in a single strategic framework. So this is where the digital decade kick in, where in 2020, and President von der Leyen announced it in her speech, in her address of the State of the Union. You know that the President is every year presenting the State of the Union to the Parliament in September, and in 2020, President von der Leyen announced a new initiative which will precisely do what I mentioned, upgrade our approach to have more cooperation, and also to give a clear objective with a digital target, digital objectives on the different fronts, connectivity, skills. This is where the digital decade was born. And then this digital decade is really the sole really important strategy which has been uniquely decided by democracies, so between the Parliament and the Council. This is a unique initiative in the world. I mean, there is no other part of the world with such an endeavor, and which also has been enshrined into a decision from the European Union, which has been translated what has been highlighted in a communication, as we do usually. In the Commission, we start with describing the issues in a communication, describing the approach, and then we enshrine this after a negotiation between the European Parliament and the Council in a legal text. So this is exactly what we have at the moment, and this is putting apart digital transformation with the green transition, in the sense that now, thanks to the decade, and I will come back to that, we have a clear target, we have clear governance, enabling member states to discuss and to progress together with the Commission, but also we have cooperation tools, thanks notably to new type of multi-country projects. So all this together in a legal text that enable us to move forward. On the next slide, I think we are going to see also one very important element of this plan, as Lavinia mentioned. For us, digital transformation needs to have a purpose. It's not an end in itself. It needs to serve people. And this is very much described in a declaration on digital rights and principles that is really, really going hand in hand with the digital decade, and which is describing all the different rights and principles that people should benefit from in this transformation. And you can see that today, for today's discussion on healthcare, the first very much point of this declaration is the fact that we want to put people at the center of digital transformation. Digital transformation needs to make people's life better, more prosperous. It needs also to make sure that we respect rights and aspirations, and to make sure also that this transformation is benefiting people, in particular their health. And to do that, in an effective way, we have some targets that we are monitoring every year. So in a sense, it's not just a plan that is a strategic plan with a set of general objectives. We also have very concrete targets in which we are monitoring all the different aspects of the digital transition. You can see in red everything which is about infrastructure, in blue the take-up of new technologies, in green the aspects of skills, and in purple the different aspects which are linked to e-government services online. And here you can see that there is the mention of access to e-health record. So in the decade, we are not just measuring e-health record, because our approach for e-health is much broader, as you will see. At the same time, we have a specific key performance indicator that enables to follow how member states and how collectively we are progressing toward offering citizens access to their e-health record. So that's a very important element. Then the second extremely important element now, which is about governance, because it's good to have targets, but it's better to reach them. And to reach them, we have a cycle of cooperation in which we are going to annually report back where we are. And this year, this milestone is going to be happening at the end of this month. You will see quite important report, the State of the Digital Decade Report 2024, in which we are going to take stock on the different aspects of our digital transformation. It's a major report. It's more than 1,000 pages. You will see a communication that will be adopted by the Commission. And this report is the starting point every year to discuss with member states. It is presenting an analysis, but it's also presenting recommendations to member states. And you will see this year that we are going to produce a series of recommendations to member states on e-health in order for us to cooperate and to progress in this field. So that's a very important element of the governance mechanism. The second very important element is the fact that member states need to provide us with national roadmaps. This is about their plan in each member state, how they are going to contribute on the different aspects of digital transformation. And we expect, of course, them to set out measures, policy actions, which are going to contribute, in particular, in the area of health. And then maybe to conclude with two last slides, maybe just a hint to what we have at the moment as an analysis, which is very much summarized here, but which will be developed later in presentations. I mean, first, reminding us that we have a clear target that we need to achieve. So in a sense, the commitment of member states is a legally binding commitment to really cooperate with us to reach this target in 2030. I would say we are in good track, but there is still quite a lot of effort to be made. The second point is that, people are supporting very much this endeavor, and we have had several Eurobarometers in which people are really telling us clearly that they consider that digital technologies are to be very important for their healthcare, and they would like really to have and to benefit from this as much as possible. And then there are three elements which are critical for us. I mean, first, this is about data spaces. We need to have the right data spaces that will enable us to innovate, to increase the quality, to increase prevention, and to develop personalized approach and support research. Here, you will hear a lot about that, but without data space at European level, which means that there will be some cross-border element that needs to be also injected in. There is no way we can succeed. The second element is, of course, regulation. Regulation is part of making sure that we have all the same approach all together for addressing these issues. And last but not least, cooperation is very much at the heart of the endeavor. And you will see a lot about multi-country project, about European Digital Infrastructure Consortium, which are one of the top success of the digital decade so far. Member states and us are really accelerating on establishing this infrastructure altogether. Just to finish and conclude, to say that today we are going to really address and discuss the potential and the benefits of digital transformation on health, but we are going also to have another session, another Connect University in September, in which we are also going to look at the other side of the transformation, which is the impact on health of people. I mean, you certainly are aware of the challenges that are increasingly important with the rise of exposition to digital tools and technologies, and this is also something that we want to address, in particular for minors, because we see the problem raising. But in any case, again, thank you so much. Thank you to the team and to Lavinia, and let's hear from the real experts on these issues, how we can make this potential for better healthcare thanks to digital transformation a reality for all now. Thank you very much.
Thank you, Eric. And well, actually, I just wanted to mention one point, is that we decided to do this particular session on healthcare because of you, the participants on Slido. They told us that they were particularly interested in this section of the Digital Decade Policy Program. So for us, it is not only reflected in the Eurobarometer, but also in what you are telling us on Slido. So for us, this session is particularly important. Now let's move to Saila Rinne's presentation. She will tell us a bit more about, give us a general introduction on what we mean by health data and its associated opportunities and challenges. Thank you, Saila. The floor is yours.
Thank you very much, Lavinia, and thank you for the team for organizing this session. Of course, my unit in charge of e-health, aging and well-being, we are particularly happy to organize this session because these are the topics close to our heart, and we are very happy to also share information and receive questions in this field. And also, I would also like to welcome everyone to this session, and I hope that it will be useful for you. And my presentation will be about setting the scene for the next speakers, mainly having a few key messages. Next slide. So looking at opportunities and challenges. Next slide, please. So when we are talking about digital health, so of course it's often about health data. We are talking about basically medical devices, medical technologies. And when it comes to data in particular, the great opportunities are in, first of all, for citizens, for all of us to become in control of our own health data and being able to access health data also across borders when we move, when we travel, when we retire in another country. And this is, of course, at the core of the Digital Decade KPI on e-health, and also at the core of the European Health Data Space Regulation. Then with data and digital technologies, there's a great potential to have better, faster diagnosis, also have better prevention measures so that we don't get ill. Also, the personalized approaches, both for prevention, but also medicine and for providing care, can be improved with data. And the efficiency of healthcare systems is a very important component if we are looking at how strained the health systems currently are, and we have all the challenges of the demographic change. So there is also a great pressure to deliver and to bring these efficiencies into health systems. Accessibility to health services in rural areas, for example, is a very important aspect when it comes to opportunities, and this is also actually already happening in many countries. Telemedicine services have been developed a lot and used much more during and after the COVID pandemic. Then there is a great potential for health data to also be unlocked for the purpose of having high quality research and innovation actions across the EU. Of course, we have also challenges. For example, the trust needs to be there for all of us, so that we know that when we, for example, give access to our own health data or give permission for others to access our health data, that we can trust that this is done in a reliable, trustworthy and safe way, including cybersecurity and AI solutions that are currently very actively being developed also on health data. Privacy, data protection is also part of this challenge. Then, of course, we need people to be able to be knowledgeable enough to use these tools. So digital skills, being able to understand digital tools and health-related information, digital health literacy, when it comes to both users, citizens, and healthcare professionals. This is a very important part of the puzzle. Without interoperability between different technological solutions and between digital health systems and infrastructures, we cannot go far. So this is really a backbone of everything. And it is also addressed in the e-health, the European Health Data Space Regulation. We will hear more about that in a few minutes. In the next slide, we see what are the challenges if we do not have the access to health data. So if we are looking at the different players, like first of all, the citizens, we don't have any control over our own health data. That is, of course, something which is very much desired in order for us, for example, to have better understanding of preventive measures and to foster healthy lifestyles and to have access to the doctor's reports and recommendations, and also feed into the data our own, let's say, wearable generated data, for example. This will enrich the data sets in a way that really can bring new insights and become sort of comparable to what is average, what is the baseline, and then with this type of large-scale data sets and contributions also from individuals can really make a difference. Of course, then if we think about healthcare professionals, if they don't have access to all the health data of one patient, if it's scattered in different hospitals and different caretakers, facilities, this is a big problem, of course. And then it may happen that the doctor will prescribe the same lab tests many times, so it's also creating extra cost. If we look at the providers of digital health services, there are also barriers in place when it comes to access to health data, which stifles their work, basically. And also policymakers and regulators should have access to health data so that they can make solid evidence-based decisions. And last but not least, the researchers also need, and innovators need the data. Next slide. Personalized medicine is something which is really at the core of what we are doing right now when it comes to the different data infrastructures and the support that we are giving, and that is something that technology can help, like find personalized solutions for people, so that it's not just that you give the same medicine to every single patient, but that there would be like more evidence-based decisions also when it comes to choosing different treatments and also preventive measures. And there, it's not only about technology, we need the right regulatory framework for that. And the technologies also need to be properly implemented in healthcare settings. And I already mentioned the skills and citizens' trust that are also crucial here. And of course, the backbone is high quality data. Next slide, please. There have been quite a few regulatory initiatives during the current Commission that are very much creating the building blocks for digital transformation of healthcare. We will be hearing about the European Health Data Space Regulation. There is also the Data Strategy, Data Governance Act, Data Act, and GDPR, General Data Protection Regulation, which also, of course, has already been in place for a while. Then when it comes to security and trust, several cyber security related regulations have been endorsed, and then we have the revised eIDAS regulation that we will hear about very soon as well. Around artificial intelligence, we also have very important pieces of legislation in order to increase safety and trust. We have the AI Act, and it is very much articulated together with medical device regulation. We have also regulations around clinical trials and health technology assessments and pharmaceuticals. So this forms let's say the big regulatory framework around digital transformation. And this e-health target of having 100% EU citizens access to electronic health records by 2030 is very much in line with what the European Health Data Space Regulation is asking. And it's really the empowerment of citizens part, which is crucial in this overall holistic framework as well. Next slide, please. So if we are looking at digital health solutions, they can be helpful in the whole care pathway, starting from healthy living, prevention, early detection and diagnosis, treatment and care, and follow-up and quality of life after treatments. So the potential is huge. And then as I said, there is also the aspect of supporting long-term sustainability of health system and health and social care systems, and also enhancing competitiveness of EU industry through business and expansion in new markets of these technologies. Next slide. So here I am mentioning very briefly, we will hear more about this, about how Digital Europe program is supporting deployment of mature technologies for health, and to have like health data infrastructures in place. First, there's the Cancer Imaging Initiative, which is a flagship initiative of the Europe's Beating Cancer Plan. It is linking resources and databases to have an open infrastructure of cancer imaging to train also AI-based tools. So to have high quality imaging data for improved clinical decision-making, diagnostics, treatments, and predictions. Then we have the 1+Million Genomes initiative. It's very strongly backed by the member states. The aim is to have secure access to genomic data and corresponding clinical data across the EU. There are three main strands in this initiative. First of all, to help research, but not only, also help personalized healthcare and public health. So all these elements of healthcare, public, like regulators and public policymakers and research are catered. Finally, the aim there as well is to have use in place the possibility to use genomic data for innovation, also for developing and training AI models. Finally, the latest EU initiative that was launched in December last year is about virtual human twins. This is about facilitating advanced research and technology development in silico modeling virtual human twins also for AI foundational models, and to create an ecosystem and platform for computational models of organs and organ systems. And here again, we are supporting personalized care, prevention, better diagnosis and treatment. I think this was my last slide, if I remember correctly. Yes, indeed. So I finish here and give the floor to my colleagues who will tell all about these initiatives in more detail. Thank you very much.
Thank you, Saila. And so as you mentioned, there is a huge potential behind all of this, and often undiscovered potential, because I mean, me myself, I'm writing the part of the report for some of the countries, and many of these things were completely new to me. So it's really fascinating to get to know this aspect of the digital transformation. I will leave now the floor to Renata Palin, who will explain a bit more the logic behind the e-health indicators and what we measure. So normally, I think access to e-health records and basically where we stand at EU level, how this fits into the Digital Decade Policy Program, and what is at stake for users in this sense. So Renata, the floor is yours.
Thank you so much, Lavinia. It's so good to be here. Let me start with briefly relating to Digital Decade. On the next slide, you have the reference to Digital Decade and elements that colleagues Eric and Saila kindly highlighted in the context of health data. The Digital Decade, as Eric mentioned, it's not just a policy program, it is a shared vision of digitally transformed EU, Europe, where we are advancing with the technology and at the same time make sure that we build on our shared values, such as putting people at the center of this digital transformation and making sure that technology serves and empowers all people living in the EU to pursue their aspirations in full security and the respect of their fundamental rights. It translates into assuring that we all can benefit from public services being digitally accessible in a secure and inclusive way, and no one is left behind due to the insufficient quality of the service or lack of skills. As you see, in the domain of public services, the Digital Decade Policy Program established the target of 100% of Union citizens having access to their electronic health records by 2030. So when we were presented with the target being agreed with member states and then the Parliament and College and Commission, it was the time for us to answer the concrete questions, how to operationalize such a target and provide a robust methodology to measure the progress towards 100% across the EU and over the time until 2030. On the next slide, you have the perspective that it's mostly important, which is perspective of the users. So we have access to electronic health records, in short, access to health data. How to make the service relevant and useful for the users, citizens and patients. Imagine you are a patient and have already some history of your treatment, like Saila mentioned. Perhaps you want to seek a second opinion of another doctor, or you are willing to support research actions with your results to help others in their health issues. Or you just want to be able to track your health performance over the time, days, years, or even decades, and regardless of the point of the care that you're using. Which data would you find relevant and useful, so to feel empowered and be actively involved in your own or your children's or your elderly one's health journey? One of the possible solutions, provided we have them interoperable, is provide the equitable access to electronic health records in all EU countries. So as you could see, some examples here, some in the middle are in, unfortunately, very small print, so would be difficult for you to read. But basically the list here includes a patient summary. It could be named differently in different countries, but basically the content is similar. This is the information on important health-related aspects such as allergies, current medication, previous illnesses, surgeries, etc. Or you would have laboratory results, blood, urine tests, or medical images such as X-rays, CT scans, MRIs, etc., or organs, or lungs, livers, whatever. You would potentially have a prescription or e-dispensation that makes the purchase easier and saves the trees, as no printing is needed. You would have hospital discharge reports with all the information of any treatment that you received there. So it's clear that this data has real value for the ecosystem, for the healthcare provision system, and for the citizens that can truly empower them. On the next slide, you'll be having a bit kind of broader perspective, because applying user perspective is not, it's of key importance, but it's not the only one that needs to be adopted. There is also perspective of the service providers at the national level, and the complexity of the definition itself, the definition that had to be constructed to make sure that we are measuring the same across the EU. So to meet the challenge, we launched the study to design the methodology for annual data collection. And during very intense process of consultations with member states, we formulated a composite indicator based on a granular, as you can see, approach that comprehensively analyzes all this faceted of the access to e-health records and covers 12 sub-indicators in 4 themes that are presented on this slide. So you have like 4 layers: implementation of electronic access service, categories of accessible health data, access technology and coverage by population healthcare providers, and equitable access opportunities. So the implementation of electronic access service was put there to capture the availability of access services that covers the whole country, making sure that it includes the specificity of some countries with more regional structure of the healthcare systems, which is the case, for example, for Italy, Spain, or Sweden, or even Czechia. Categories of accessible health data with minimum data categories stored in national electronic health record systems, following European health data space regulation logic. And access technology, including very important aspect of secure, trusted, easy to use access via portals or apps, using access technology such as EID, preferably compliant with ADAS regulation, and coverage by population healthcare providers, both public and private. And the equitability of the access, making sure that we are covering elderly or people underage or disabled, so the solutions are compliant with Web Accessibility Directive. On the next slide, you have the results that I could share for the moment, as the results for this year edition will be available very soon. So you need to stay tuned, make sure that you see it when it's going to be published, which will be in 1-2 weeks time. What I can give you, it's the taste of how EU is performing in relation to citizens' access to electronic health records. The data was collected in March 23, and the responses represent the state of play as of end of December 2022. So it's not the latest figures, but they show you the logic and how EU is performing. So to highlight some elements, at the end of 22, EU average scoring for this composite, very complex indicator was 72. And almost, as you can see, almost half of the member states were either below the EU average or slightly more were above this average. And areas where policy interventions could help improve progress towards digital decade target included categories of accessible data, secure authentication means, healthcare providers type being connected and supplying the data timely and completely, and equitable access opportunities. So in the first category, specifically, the information they could find interesting is that what we see across the EU, most widely accessible data category is obviously e-prescription and e-dispensation and summary data. And on the other side was electronic results and reports that were least accessible category due to medical imaging reports and images mostly not accessible in electronic format, like PDF or PNG or JPEG. Few countries scored significantly below average, signaling only very few data categories accessible and updated. In the second area related to secure authentication, the situation last year was that half of the countries were able to provide the authentication following ADAS regulation, compliant with ADAS regulation, with pre-notified secure authentication means. Others were providing the access while using nationally notified EID schemes based on two-factor authentication or other means. In this third area of spectrum of healthcare provider types connected to data and infrastructures and supplying relevant data, 6 countries scored around or below 60 in this layer, mostly due to majority of healthcare provider types not being connected to health data access service. And last but not the least, in the area of equitable access opportunities, including compliance with Web Accessibility Directive, only 7 countries ensured equal access to electronic health data for everyone. So to summarize the results we had last year, and hopefully they will be improved next year, in terms of these 4 layers that you can see in colors, access, technology, and coverage, which is blue, and access opportunities perform better compared to categories of accessible health data, which is yellow. This suggests that while the technological infrastructure and opportunities for access are in place, there may be room for improvement in terms of the types of health data that are available to the citizens. So next to most accessible category, which is the e-prescription, e-dispensation or summary data, we do hope that electronic results and reports and medical imaging in electronic format would be also made accessible. And in terms of technology layer, the EID and the access using EID or access portals, having the the more secure access compliant with ADAS regulation, but still it's a solid base already reached, and the population is covered as well. So I hope that I see some questions. I'll just conclude with truly hoping that what we do in the context of digital health and data access, we do something that matters to people and change their life for better. And I hope that seeing last year's results triggers your appetite for this year, that potentially would happen 26th of June if Eric confirms the date. I don't know if we are having the time now for answering the questions, or we do it later on.
We will do it later on. I think we can. We're gathering now all the questions on the Slido, and we will have a dedicated moment, Q&A session after all the presentations towards the end of the session.
So that's all from me. Thank you so much. I'll hand over to Maya, as I assume. Thank you.
Thank you. Maya, the floor is yours.
Thank you very much, and thank you, Renate, and good morning, everybody. So, you have been hearing about health data access and the way to identify, and well, I'm here to explain a bit what is going on this electronic identification world, and what we are doing to try to facilitate life for everybody here on what is an EID. First thing to say is that you have heard about the IDAS, and then I'm going to talk about the electronic identification and the digital wallet. But these are basically the two linked concepts. So the IDAS regulation was the first regulation that was put in place in 2014, and the amendment just led us to the European identity framework that in fact presents the European identity wallet. So when we talk about the IDAS or the European identity wallet, in fact what we are talking about is the EU regulation and electronic identification of trust services. So having this clarified, let's move to the next slide, please. Next slide again, please, so we can just go to the context. I will make a general overview of what is the EU identity wallet in the context of the European Identity Framework and the proposal. A bit on how are we testing and how it relates to the e-health area in the large-scale pilots, and in fact, what can be done in the health use case. So let's move to the next slide, please. Next one. Okay, so first of all, again, I think that we have heard a lot about the digital decade policy, because in fact this is the light that guides us on what we need to do. And there are targets on e-health, there are targets on accessing public services, but of course there is a target on what relates to the electronic identification. And what happens is that for 2030, what we need to have is 100 of the union citizens able to have access to a secure electronic identification means. This is very important because all the work that you are doing, it's going towards building a system that is secure, but also that allows the citizens to have to be in control on their identity data, but also on the transactions that are involved in terms of authentication and access to different services. So if we move to the next slide, let's start with the basis, because what is the European Identity Wallet? In the end, the European Identity Wallet is the answer to the challenge of digital identification in the EU, and it's the answer that the European Commission has put on the table. So, in fact, what it is it's a tool that will allow to securely identify yourself online when you are accessing to a wide range of public and private services. It's very important now that we have, let's say, try to facilitate the entry in our world identification and in the ADAS regulation to private services, because in the very beginning the regulation was more targeted to public services, but I mean it was very clear that also private services need to be in the context of what we are doing on identification. This is a tool. This is a tool that will allow you to store identity information, to present it, and also to share other kind of, let's say, identity information that is not the basic one for you to access a service, but it's more related. It's information related to the citizen that can be also shared in a secure way, that can be university diplomas, or we could go even to train tickets, for example, if we go to a more, let's say, a common use case. It will also allow you to sign documents, and following the target that I showed in the first slide, so it needs to be available for every citizen in the member states, every resident, and also every business. So let's move to the next slide. Okay, yeah, just click again and we can see everything, and I explain it to you, because what happens is that there is not going to be only, no, just move to, thank you. There's not going to be only one wallet. There will be wallets issued by each member state to their citizens, but in a way that they are interoperable. This means that if I have a Spanish wallet, I can access public and private services in other member states in a seamless way. So it will be a different wallet with one set of open specifications. We have one open source reference implementation, and of course the wallet will be interoperable, because in fact it's not really interoperability, it's harmonization, because we have different wallets that are based on the same principles. If we move to the next slide now, so what is the benefit? What do we see here? In the end, the goal is it's the one that is set in the digital decade. So it needs to make life easier for the different stakeholders that we have. So for the citizens, is the super important, because the aim is to protect personal data, to simplify their life when they are trying to access public and private services, but also for the government, because they can improve the access to the digital services that is also linked to the digitalization of the government. That is also a goal in the digital decade, but it can also enhance fraud prevention and improve security. Same thing for relaying parties in the end, because they will have something out there, a way of identifying their users that improves the security and the privacy. And in the end, in this society, the aim is to digitalize and to have, let's say, enhanced tools to increase the online transactions in a secure way. And in the end, I mean, what we aim with the digitalization of the European Union, that is in the end the economic growth. So we can move to the next slide. Okay, so yeah, I've been mentioning this also within the other slides, but it's super important, because this is the characteristic and the basis of what the system that we are building. It will be free for use for all EU citizens. There will be an obligation by the regulation that they offer their citizen UDA wallet free. Of course, for the citizens, it's voluntary. It's not an obligation to have a UDA wallet. It needs to be accepted throughout the Union, recognized by private and public services. Private services have certain, requirements for the obligation to be recognized, and then it's built in a secure and privacy-oriented way. Again, as we have been talking, I have been mentioning throughout my presentation, is the citizen and the control and the protect of their identity and personal data is the basis also of the whole system that is under development. So let's move to the next slide. And this is just to have a more clarity on what the UDI wallet can do. So it's three main functionalities. One is the pure identification, authentication of the user. So I will have my data that allows me to say, okay, this is me. Let me access to your service. But I can also store another kind of credentials that are linked to myself. That can be diplomas, that can be health records, that could be driving license. So there's a really wide range of information that I can store here also in the European Identity Wallet. And it will also allow me to sign and seal electronically. Let's move to the next slide. Okay, and now I think that this is super important to understand, because the wallet, it's not the wallet alone, it's the wallet and everything that is around it, because the system is not only an application that goes to the smartphone of a user. We need to have different actors in play here. We need to have the member states that are the governmental bodies that will issue and the wallet to the citizen, but it also involves data protection authorities, conformity assessment bodies that will be the ones that are in fact checking that the wallet are UDI wallets to be issued to the citizen. We will have the wallet providers that could be member states directly, but they can also designate some other providers. But then we have let's say the entities that are issuing the information to the wallet, because this is not going to come only from the governments or the member states. So we will need to have trusted organization that can provide information for you to identify it, but also we can have the issuers of credential, the university that issues my diploma to my wallet. In the center, of course, is the user, because with the user we don't do anything. We need to have the user that also let's say it's the one managing all this information that comes from the different parties, and the service providers that are the ones that are consuming, in fact, the information that comes from the wallet user and from the wallet in the end. Let's move to the next slide. So yeah, just go until the end. This is was super quick until this side. Thank you, because it's just for you a bit to understand how the thing works. So the member states will have a mandate, and will have a mandate to offer wallets to the citizens. So then there will be a wallet provider. There will be the member state, or as I explained before, it can be another entity that is designated by member state. This is very important, because not anybody can provide a wallet provider. It needs to be someone selected by the member state. Then I am, as a user, I go to the wallet provider and I download my wallet. And then I go and ask for my identity information or any credential that I want to use and that I want to share. Whenever I have all the information in my smartphone, then this is the time where I can start to use it to access services and to share information with different relaying parties. But the relaying parties also will have the next step, that will be, how can I verify that all the information that comes from the user is valid? And then around all this system, I mean, this is put as a last step, but in fact, this is the system that covers all the actors that we see here. You could check in a trust system that, in fact, all the information, the wallet that the user is using, that this person that is claiming that it's one person in particular, in fact, it is. It will be able to be verified in the trust system. So let's move to the next slide. Okay, this is super quick on what we've been doing, because in fact the regulation is super new. It was adopted. Well, we have the first regulation on eIDAS that comes from 2014. Then we needed to make the revision, the evaluation. There was a public consultation launch, and in 2021, the Commission adopted the proposal for the regulation establishing the European Identity Framework, and also a recommendation for a common EU toolbox that, in fact, it's where Commission with member states. We have been working together to develop the technical part of this regulation, because I mean it made sense to do it in parallel while the legal discussions were going on, because otherwise it would delay a lot having the wallet for the citizens in the end. So there was a proposal in 2021. During 2021, 2022. And 2023, there were the discussion, the trialogues, all the discussions in the Parliament and then the Council, and finally we had the legislation adopted this year. On the 20th of May, it entered in force. But what happens is that as it entered in force, there's no obligation at that point in time for member states to issue wallet. There's a period where they can still adapt their system. They can just try to start to work on how they want to develop and to build their wallet. So the wallets, the obligation for member states to issue wallets to their citizens will be by the end of 2026. So let's move to the next slide. And now I wanted to talk to you about a bit the large-scale pilots, because this is in fact where we test the wallet in different situations, because all of that I've been talking about is quite abstract in a way. So this is where we test in fact the implementation of the wallet. And if you move to the next slide, please. Okay, so you can see here what are the examples of where we can use the wallet. We can use the wallet to access government service. We could have a driving license inside. We can have a diploma, but it can also be used in health. We can also use the wallet to access health services, but we could also think about having health information in the wallet. I mean, there are a lot of other, as you see there, use cases for the wallet. It's not a wallet only mainly for health system or for accessing government service, but it's meant to be able to be used in really a lot of different scenarios. And if we move to the next slide. Okay, so now we are actually testing through 4 consortia that are working in different scenarios, in payments, in travels, in education, in social security. And we have one particular that I will talk you after a bit more in detail, that it's working currently on the health area, particularly in the e-prescription use case. They started 1 year ago. And they will end the piloting by I think it's mid next year. Can we move to the next slide? We have a new call. I think that this is also interesting to know, because we don't want to stop here. There are 4 prioritized use cases mentioned in the call. That is the wallet for business, for travel, payments, and age verification. But in fact, what happens is that this call is open. So even though these are the 4 prioritized areas, we could have a use case, we could have a pilot, an implementation that is not in this area. And in fact, the e-health area is super wide, so we could perfectly have another proposal to test the wallet in another let's say implementation for e-health. Let's move to the next slide, because I wanted to talk about a bit on how you can use the wallet for any health use case. So if you go just to the next slide, we have the prescription now. It's a solution that it's based on the system of the prescription that Renate also mentioned in the previous presentation. They are basing that on the solution. They are trying to test how to use the wallet based on that solution. and in cases for national and cross-border usage. We are, of course, when we talk about pilots and use cases, what we aim to do is to have cross-border situation, because this is it's the wallet is conceived not to be as a tool national, but as I explained in the very beginning, it's a harmonized solution that you can use to access services in any member state. But it can also enable to access to health information, because in fact, in the end, the wallet is a tool, but it's an eID mean. So it's a security ID mean that could perfectly be used to access any health system or service that you can think of, but also can be used as a way to prove that you're a healthcare professional. And we have been also discussing with different groups on, okay, but I need to have certain information in parallel, not the basic information of my identity, but then I will need to prove that I am a doctor or I'm whatever. So it's a very easy tool to be implemented to take in the wallet your information about the credential or to be stored in the wallet. So I think this is my last slide. Oh no, this is the very last. It talks about the prescription and how potential is among others implementing the use case on prescription. But there are 10 member states now piloting. There are different mix of stakeholders, health institution, ministries, organization, and Italy, in fact, leads in the number of stakeholders that is in this consortia. But yeah, it's kind of a very interesting use case that we are following, but we really hope that we can have other use cases for the UDI wallet on the e-health area. And I think that with this, I do finish my presentation, and I thank everybody.
Thank you very much, Maya. And as we keep collecting questions from the audience, I think we will address them at the very end. But thank you for those. Thank you to those who are contributing to that part as well of the session. Thanks again, indeed. Looking forward to seeing how that can make a practical change in our daily lives. I'm sure some people in the audience have moved countries, travel often, are using so many apps. So potentially we can see here the potential of this making a difference in our lives every day. Now we're going to move to the second part of this Connect University. We're being joined by two more colleagues. First, Konstantin Hipponen, who's Program Officer, EU Policies at the unit that works on e-health, well-being and aging. And then Owe Langveld, who's Policy Officer on European Health Data Space at the unit responsible for digital health at DG Santé. And they will tell us a little bit more about what the European Health Data Space is about. It's a regulation, sure, but what is it about? What's the architecture around it? And what timeline are we looking at? So I believe the floor is yours, Konstantin. Thank you.
Thank you, and good morning, everyone. So indeed, I will start the presentation by explaining the basics of the EHDS regulation and its first half on primary use, and then my colleague from DG Santé, Owe Langveld, will continue about the secondary use and also will present the implementation timeline. But let's move on. I think we have to switch the slides. Maybe we can go to the first slide about what is the EHDS in a nutshell? Now, the negotiations on the European Health Data Space regulation culminated in a vote by the European Parliament less than 2 months ago, on 24th April 2024. So the co-legislators have reached an agreement, and the regulation is now going through the last stages of the legislative process. It is not yet in force, but is expected to enter into force later this year in autumn. As you can see, the regulation contains 3 strands. The primary use strand is all about putting the patients, natural persons, in the center and ensuring that their data can follow them if they use services of different healthcare providers within their own member state or abroad. In strand 2, to provide electronic health record systems manufacturers with an easier access to market across member states, the regulation will introduce harmonized requirements for interoperability and logging components. And this increased interoperability would also contribute to facilitating data sharing, to the implementation of the rights of the natural persons, saving time and money for patients, and reducing switching costs, decreasing, for instance, vendor lock-in effects. And finally, in the domain of secondary use, which will be presented by my colleague, researchers and other data users will be able to access health data through a harmonized process is implemented by all member states. This would advance science and create innovation for the benefits of the whole society. We can move on to the next slide and take a closer look at the rights of natural persons in primary use. So how would citizens benefit from the EHDS? And the answer is that they will benefit from a new set of rights to their electronic health data. They will be able to access their health data online through portals or apps, or authorize another person to do so. So, for instance, an elderly person could choose to authorize their child to help them in the digital health universe. Natural persons will be also able to download a copy of their data in the European format and have it accepted elsewhere. Where they spot mistakes in their data, citizens can request rectification of data again online. And they can be in control of their data, they can set access restrictions, and they can also see who has accessed their data. They can see access logs. In addition, the insertion of the information into their electronic health records may take the interaction between patients and health professionals to a completely new level. And data sharing, of course, is an important, really important element of the EHDS, so that treating health professional can get access to the data of their patients, regardless of where in the EU the patient comes from. If we go to the next slide, we'll see that the rights, the rights of natural persons have to be implemented for a number of priority data categories listed on this slide. A common European electronic health record exchange format will be defined for all these priority categories, and member states may also go beyond. They can implement the same rights for additional data categories, and there is also a possibility to exchange such additional data cross-border on a voluntary basis where it's supported. How this data is going to be exchanged cross-border? Let's go to the next slide to see that there is an infrastructure for this. It's called My Health at the EU. It is operational already in 14 member states, and more are to join already this year. Currently, this infrastructure supports the exchange of patient summaries and electronic prescriptions, but the projects are already ongoing to expand the support for the data exchange to all the priority data categories. How does it work? Next slide will show the basic architecture. You will see that the architecture is built around the national contact points for digital health, which are to be established in all member states. And the data is exchanged directly between these national contact points. Sometimes we hear a mistake or an erroneous understanding that the electronic health data space is putting the data somewhere in one cloud. That is not the case. That is not the case at all. The data is exchanged between national contact points in the cross-border infrastructure, and there is no central storage of data. There is no central cloud. There are two new possibilities offered by the EHDS for My Health at the EU. First, it's possible to also connect the My Health at EU infrastructure to other international infrastructures. And second, it's also possible to connect third countries, of course, only where necessary prerequisites are met. And one important example is, of course, the sufficient level of data protection and security, which has to be confirmed through a compliance check. The data is exchanged through the My Health at EU infrastructure in the European format. On the next slide, we'll see the full article on the European format. And maybe if you click once again, we can see a simplified version. So the format is to be laid down in implementing acts, and the format is expected to include harmonized data sets, coding systems, technical interoperability specifications for all priority data categories. It's like a language for their exchange. And the format can also go beyond those priority data categories. It can be established for additional categories of data to support those member states that want to go beyond the priority data categories. Now, how the electronic health record systems are going to implement this language? There will be a set of common specifications to further define the requirements for EHR systems to do so, and that is the last strand I will be speaking about. But let's see how the format is created first. On the next slide, you will see that while it's for the Commission to adopt the implementing acts on the format, a lot of preparatory work has already been conducted in previous projects, and several actions are ongoing with more preparatory work. There are projects financed under Horizon, for instance, Expand DH, XShare, and there is an ongoing joint action XT-EHR, which is funded under EU for Health. So this joint action will develop recommendations for the format, drawing together the results of many previous and ongoing projects. And the format will be implemented in My Health at EU, but also in all EHR systems placed on the Union market, and support actions will be running in order to offer help to implementers. I'm going to my last slide before handing over to Ove. So the second strand of the EHDS will provide requirements for EHR systems, electronic health record systems, driving their interoperability, and will be defined. The requirements will be defined for two harmonized components. So all EHR systems placed on the Union market will need to have those two components, first for interoperability and second for logging. The goal is to enable the implementation of primary use under the EHDS and also facilitating harmonization of data for secondary use, but also to decrease the barriers for EHR system manufacturers selling their products in different member states. And here, I think I'm handing over to Ove, who will present the next part. Over to you.
Hello, good morning also from my side. So, after Konstantin talked about the first two legs of the EHDS, now I'm talking about the last one, the secondary use. So this is about unleashing the potential of the data economy in the health sector on the one side, but also to have a better evidence basis for regulatory activities and policy making. So what we're doing is to make sure that health data are available for certain research and other public interest uses in a safe and secure way. I'll get to the safeguards in a couple of slides, but the broad approach on how we do this is that we will have common European rules telling health data holders and our lingo in the regulation which data categories they have to make available. There will be health data access bodies that receive applications for data, vet them, and then afterwards collate the data for making it available. We're also providing certain common infrastructures for this, particularly in the cross-border side. So in the future, you'll be able to as a researcher, pick from the European data catalog, saying, you know, there's this data set from this French hospital looks interesting. I'd like to analyze that together with another data set from a Finnish hospital, and that is something that will be possible by under the EHS once fully rolled out. There's also certain other supporting things like the data catalogs, but I think the main thing now to see is a bit of what the user journey would look like. Next slide, please. And so imagine you're a researcher, you're looking for data. There's some animations here, so just click through them, please. So once the step one to many, thank you. The step 0 that's not shown on this slide here is that the health data holders will have to declare what kind of data they hold with a short description of it to the health data access bodies that put them in the catalog. And then the data user, so for example, a researcher, would go to that catalog, go through it, see what health data exists to support my research. They pick and choose what they need for what they would need for the research project, submit the application where they explain who they are, what they're doing, why they think that data is necessary for the research that they have planned. The health data access body, so that would be a public sector body that is charged with receiving and assessing these applications, takes a look, checks whether the criteria are met, so for example, on allowed and forbidden purposes of use. If so, everything is met, they issue the permit, they get in touch with the health data holders to obtain data from them, pre-process them, pseudonymizing, anonymizing, and making them ready for reuse in a secure processing environment where the user would log in and then do their analysis on the data, use it, process it, and then important thing, what they can take out of that environment are only non-personal / anonymous data. So they can get results back on, let's say, using this kind of follow-up treatment versus another one resulted in health outcomes that were better in this way, but not any information on individual patients. They will also have obligations to make certain outcomes of it publicly available, and all of these permits and decisions and outcomes would or will also be available publicly via the HDAP website. So there's a whole transparency system so people can see what is going on in secondary use. Next slide, please. Yes, so I already talked a bit about the process here and the safeguards. So we would have these health data access bodies as independent public sector bodies that assess the applications. Of course, any data needs to be as much as necessary, as little as possible for processing data. So that is also the guiding principle that the HDAPs would use in data preparation. When they put it then available in these secure processing environments, there will be strict access and export controls from those environments. Everything that the user does in there will be logged. Applications, permits, and results, there's going to be public transparency on that. Now, what I talked about so far was mostly safeguards on privacy matters, since the information that would be made available are, for example, data from hospitals on treatment that they have provided. Of course, anonymized, pseudonymized as early on in the process as possible. So a user would in the environment never see, and this is the treatment record of when over went to hospital X. what they could at most see is something like, this is the treatment record of a male resident of Brussels region aged in this group, because sometimes, of course, these geospatial or just broadly demographic factors are also relevant. So, for example, different outcomes by age group. But that's that part. Then some of the data to be made available may also be, let's say, sensitive under intellectual property angle. There we have a process where the holders would basically declare, attention, dear HDAP, note this data set that I have here is subject to certain intellectual property limitations. And then they would enter into a dialogue with the HDAP to still make it available as far as possible, but to also have those safeguards there. That is, for example, for data sets held by pharmaceutical companies, where this may give an insight into some of the internal thinking. And finally, back to the privacy side, one important outcome of the negotiations there was that there will be a right to opt out for individuals from having their data be made available through this process. So in the future, I would be able to say, I don't want my data to be made available under this process, and then they would be filtered out for that purpose. So that's kind of broad overview what we're doing, what happened. So next steps, indeed on this slide. So Konstantin mentioned already, so we had the parliament vote, but given end of parliament mandate, in the end, what is happening here is that the adoption will be under what's called the corrigendum procedure. And to not go into too much rules of procedure of Parliament and Council details here, the outcome is that we expect publication of the official journal late 2024, around the end of the year, basically. And that, the publication in the official journal of the text is then also what triggers the starting gun for the transition periods. So based on that assumption, we're looking at entry into application around end of year 28 for the first batch of priority categories that Konstantin talked about, so e-prescriptions, dispensations, and patient summaries, and also large parts of secondary use. And then there are some parts which are, let's say, a bit more complicated to develop, where the outcome is that there's two extra years. So in primary use, that would be about exchanges of medical images and related studies, lab results, test reports, these kinds of things. And on the secondary use side, it's also about making available certain categories of data that are a bit more complicated, for example, genomics and other omics data. So there's quite a bit of time to prepare, but there's actually also quite a lot to build in that preparation. And there we are supporting kind of in two flavors. One is, and Konstantin already mentioned some of these, is that we're running numerous projects and joint actions that will develop some of the more technical things. So for example, on the exchange format, we have the broad requirements in the text, but really the detailed technical specifications. Of course, we can't, that's not something to put in the legislative text as such. That will be done later, kind of via tertiary legislation implementing acts, and some of that input for that is going to be generated through a number of these projects and joint actions that we're running. That's the one side. The other side is that, of course, there's quite a lot of investment also required in the member states, for example, to simply set up these health data access bodies. And we're also supporting them with direct grants for that. And the third thing in a way on preparation is that, of course, also we as Commission, so we will be providing certain infrastructures to the member states. So that is both the exchange infrastructure that Konstantin mentioned for primary use and also on secondary use. Well, I didn't go into detail there now, just for timing, but there we also have an infrastructure that supports these multi-country access requests that we're building as well now in time for it to be ready. And that is then kind of a service that we will, as Commission, provide to the member states. So that was kind of the quick tour de force through the EHDS. And I think the next slide is already the thank you slide. No, oh, wait, this next slide, please. And that next slide is just the graphic representation on what applies when. So indeed, Konstantin mentioned entry into force, but here's always this thing, distinguish between entry into force and entry into application. And entry into application for the key parts, as I mentioned, will be around end of year 28 and end of year 30 for some other parts. And on this now, I really say next slide, please, and thank you for your attention. Yeah.
Well, thank you so much, Konstantin and Owen, for this very interesting and, of course, a bit more technical part. However, I think you've made it very easy for us to understand a bit more what the European health data space can enable, and as well as its timeline. So thank you very much. We're going to move to the last part, last but not least, of our Connect University of today. We're going to discuss the European health data infrastructure from the perspective of what we call the EDICS. It's under the Digital Decade Policy Program. EDICS are European Digital Infrastructure Consortia, and they typically enable member states to work together to fund research, ensure capacities and capabilities are put forward and moved ahead jointly, because as we know, it is difficult to achieve those targets on our own. There are a few consortia in the area, for instance, of blockchain, artificial intelligence, and digital twins that are already on the rails, but we also have some that apply to health. So I'm going to give the floor now to two more colleagues who will now share their presentation. So first will be Simon Bielecki, who's team leader on EU policies within the unit of e-health, well-being and aging at DG Connect, as well as his colleague Alexandra Wesolowska, who's program officer for EU policies. So Simon, the floor is yours. Thank you very much.
So that's not exactly my slides.
That's the one.
Yes, so please go ahead. And one more. Yes, so in principle, the first presentation of this small subsection will be about the 1+ million genome initiative. And together with Alexandra, I will present to you the two initiatives that are spanning between kind of the digital agenda and the digital decade policy program and the European health data space that has been just presented by colleagues. Next slide, please. Genomics is a relatively new part of biomedical research, and also in its kind of early years of implementation in standard medicine. And this is an area which is very strongly dependent on data, and especially the volume of data. You might know that there are genetic diseases that depend on one or possibly two variants in your genes. So among the many thousands of genes that everyone has in their body, there might be variants that cause severe diseases, and these diseases can be very rare. To find the good medicine, the good cure for such diseases, or also to predict development of such diseases, it is necessary to enable more data to find similar patients, and that is only possible by connecting data across borders in Europe. That's why the European Commission has now, together with member states, invested quite some budget and effort into linking the data, the genomic and clinical data across Europe to enable this kind of research, and eventually to enable breakthrough in healthcare of such patients. The next slide, please. For this purpose, the member states and the Commission have together come up with a declaration, with a proposal for a joint initiative on putting together, on enabling access, secure access to a large number of sequence genomes in Europe. That was back in 2018, came out together with a Commission communication that underlined the need to work on data connection, on data infrastructures to push forward research on this type of health challenges. Later on, in 2020, the European Union came out with a European data strategy, where the European health data space was one of the proposals. So that was an additional strong building block towards enabling the potential of data in healthcare. Since then, since this declaration of 2018, member states have been working together to enable this secure access to genomic data for the triple purposes: research, healthcare, and public health. By now, almost all member states have signed this declaration and work together in this initiative. Also, some countries from outside the European Union joined this effort. Next slide, please. Europe's Beating Cancer Plan also included a reference to the 1+1 Genome Initiative, and that in a specific context of personalized medicine, which is particularly relevant or particularly mature in oncology. And also here it is perceived that looking at the genomic or genetic basics of our body can help finding the best cure for any type of cancer that we might get. And we can already now witness modern treatment of cancer that is really personalized, that is really bound to genetic tests that are performed now almost on a standard basis. Next slide, please. So I have by now mentioned rare diseases, rare genetic diseases, and cancer as a possible application of genomics. These are two of the use cases in the 1+1 Genome Initiative. But there are two more. One is the infectious diseases, where especially after the COVID pandemic, the initiative looked at the link between the genome or the genes of the person, of the patient, and the severity of the COVID infection, COVID disease, whether there are some people that are more prone to get a serious COVID and others that lighter because of their genetic buildup. And the last use case is population genetics. It is about quite common diseases that have much more complex origin in terms of our genomic structure. So it's not just one genomic variant that causes those diseases, but there's an interplay between many genes that could cause a disease, such as cardiovascular diseases or diabetes. Obviously, these do not come alone from genetics. They also come. There are also reasons related to lifestyle or environment. but the genetic aspects play a role, and this part of the research is also covered by the 1+Million Genome Initiative. Next slide, please. The 1+MG, as we call it in short, has established two roadmaps. Now the most updated one runs from 23 to 27, and it clearly links the work on the use cases, which I mentioned before, with the efforts to implement the initiative at the European and national levels. It's really about connecting the infrastructures that exist, that are fragmented across countries, to one European interface that would enable searching for genomic data of similar patients or a specific phenotype, a specific picture, characteristics of a patient across Europe in a federated manner. Federated manner means that the data would not be moved across borders, so that the data which are extremely sensitive would not travel, but it would be rather the data request, the data query or algorithm that would be sent through this central platform to the data set. That would make the whole thing extremely secure, which is important for everybody. So this technical infrastructure is one of the implementation tracks of this initiative. Another one is to have data that are comparable. So this initiative is working on data structures, harmonization of data that enables better discovery and analysis of those data. And the last which I wanted to mention here is the European health data space, where the 1+MG will be integrated once establishing the platform. And all of that should work towards enabling personalized medicine based on genomics in Europe. Next slide, please. And here you can click through to the last element. There are a number of projects that implement this initiative, and currently the biggest projects are the genomic data infrastructure and the Genome of Europe. And I think in the interest of time, I just go to the next slide, where we talk about the genomic data infrastructure project. Next slide, please. Which this is the central piece of the effort currently. It's a project funded under the Digital Europe program with 20 million euros from the European Commission and another 20 from the member states, which establishes this infrastructure backbone of the initiative which I mentioned, which relies on the federated architecture. It also will enable analysis, the federated analysis of data, and it also works on a sustainability solution for this infrastructure, which should ensure that after the project end, which will be 2026, that this infrastructure can be operated in a sustained way. And here a choice was made to create EDIC, the European Data Infrastructure Consortium, but I will talk about it a little bit later. Next slide is about the Genome of Europe project, which is now about to be launched. It's in the final phase of signing the grant agreement. Another big project which focuses on the data collection and data generation. It is about collecting and sequencing the DNA of 100,000 European citizens that should be representative for European population. And in this manner, a so-called Genome of Europe will be created, which will be a reference database of a kind of statistically typical European human genome based on this large data set. Next slide, please. And yes, you can also click through. Once the data infrastructure for genomics is created, it will be included in, it will be connected to the European health data space as the so-called data sharing infrastructure. And it will be, in this way, it will be possible to also access the wealth of information through the European health data space, the secondary part, which Ove was talking about. Next slide, please. To become eligible for the data infrastructure to to connect to the European health data space, it will need to create, and it has been already decided to create, a European Digital Infrastructure Consortium. It is a new type of legal entity that was created as a principle under the Digital Decade policy program, where at least 3 member states implementing together a multi-country project can ask the Commission to create a special legal entity to implement this multi-country project together. It has a number of advantages of having this external European legal entity. It can also participate in competitive calls in all European funding instruments. It can involve industry. It can serve multiple purposes going beyond research, which is a difference from the so-called ERICS, European Research Infrastructure Consortia. And since here the genomics data infrastructure should serve the triple purpose research, healthcare, and public health policy, the decision was taken to create such an EDIC. Next slide, please. Currently, there is a preparatory phase within the initiative to create the EDIC. So this is still with the member states, which come together to prepare the application to the Commission for creating the EDIC. But this work is quite well advanced, and most probably it will reach still this year, the Commission, with Luxembourg being in the lead and possibly hosting the EDIC in the future once everything is set up. Next slide, please. Yes, so thank you for your attention about genomics, and now I hand over to Alexandra for the Cancer Imaging Initiative.
Thank you, Szymon. My name is Alexandra, yes, and I have the pleasure today to present to you another European infrastructure, which is currently in deployment and is working towards also becoming an EDIC, as was mentioned by Szymon, and supporting the goals of the Digital Decade policy program in the area of health. Next slide, please. So this infrastructure is being deployed in the context of the European Cancer Imaging Initiative, and it focuses, as the name says, on health imaging data, and in particular on cancer imaging data. And to put this work in context, let me start by saying that it is one of the flagship initiatives of the Europe's Beating Cancer Plan, which is Europe's ambitious response to cancer, and which is calling for joint efforts between the European Commission and the member states to combat this disease. The Europe's Beating Cancer Plan has 4 key action areas on prevention, early detection, diagnosis and treatment, and patients' quality of life. And personalized medicine, digital technologies, research and innovation are among the cross-cutting themes of this plan. And this is where the Cancer Imaging Initiative falls in that category, on the cross-cutting lines of work, because the overall aim of the initiative is to foster innovation and deployment of digital technologies, and in particular the technologies based on artificial intelligence in cancer treatment and care. So this initiative was launched in December 2022 by the European Commission, and it capitalizes and brings forward the work of a cluster of 5 research projects that the Commission has been supporting from the research program. And these projects dealt with artificial intelligence and health imaging. These were large-scale projects and which have demonstrated how health imaging data can be pulled together, harmonized, and used for developing AI-based prediction models in cancer. So now in the Cancer Imaging Initiative, the achievements of these 5 projects, the technologies and the tools that they have developed are used to deploy and populate a European federated infrastructure for cancer imaging data. Next slide, please. So, so this infrastructure that is being deployed is called Cancer Image Europe, and it's a pan-European digital infrastructure which addresses the fragmentation of the health data, and in particular the medical images of cancer, and has the goal to support the development and validation of AI tools towards precision medicine. So what do we mean by medical imaging here? These are radiological and nuclear medicine images, such as magnetic resonance imaging, computed tomography, mammography, or positron emission tomography. These are technologies, these are medical imaging that are used regularly in diagnosing and treating cancer, many types of cancer. So cancer patients undergo radiology and various imaging examination along the care pathway, and the imaging data plays a key role in cancer diagnosis and treatment. And with recent progress in the field of artificial intelligence, imaging-based AI approaches and AI-based tools trained on the imaging data have big potential to become useful clinical tools. And what they do is that they can help clinicians in early tumor detection, in the assessment of tumor aggressiveness, and also to, for example, to assess the survival prediction. So what we see is that radiology is evolving from a field that dealt with interpretation of a single image to a field that can inform patient treatment. And in fact, information that you can get from an image, features you can extract from medical imaging together with other types of data, with genomics, with proteomics, metabolomics. If you link these pieces of information together, this is the foundation of the precision, the personalized medicine. But to get there, we are not yet quite there because the development of such medical imaging-based AI solution relies on the availability of high-quality data that was mentioned by several speakers before for the training of AI algorithms. And this is currently a major constraint because these imaging data is heterogeneous in format, is obtained on different equipment, different machines, different manufacturers, and also it's highly fragmented among the different hospitals and distributed across Europe. So this initiative, the Cancer Image Europe, is targeted to overcome these challenges in data availability for AI training. It also will be a federated infrastructure of cancer-related radiological and nuclear medicine images and related clinical information to support development, training, benchmarking of AI solutions for precision medicine. And also here, this is being deployed currently by a project funded under the digital program, which started in January 2023 and will run for 4 years with a large consortium involving many partners, clinical data providers, researchers, research infrastructures, but also industry stakeholders. It is co-funded 50% from the Digital Europe program, and the remaining 50% comes from the member states. And among the target groups are researchers, innovators, and clinicians, where innovators are an important target group because one of the use cases here is to help them develop these tools, help them make available a data set where they can train their algorithm towards then the regulatory approval in clinical settings. Next slide, please. To maybe talk about what can we expect from the infrastructure. So in terms of the size of the images, by the end of 2026, this infrastructure will include over 60 million annotated cancer images from over 100,000 patients. And that's the sort of midterm goal, because the plan is that this infrastructure will be growing in terms of the resources it connects. There is a process that is being put in place to make that happen. In particular, this will be a federated data warehouse approach, which will make it possible to deploy observational studies at hospitals in a more efficient way. And it will make it possible for this infrastructure to continuously grow in terms of high quality cancer imaging data that is available. Also, a particular focus will be on engaging the cancer screening programs. The infrastructure will include imaging data from cancer screening and will foster the uptake of AI-based tools in cancer screening. Here, cancer screening of lung, breast, and prostate is particularly relevant because it is based on imaging data. So, so the goal here is that this atlas of imaging and the amount of data will increase the evidence and the amount of real-world data which is representative of the European population. It will make it possible to validate these AI models in oncology so that they can fulfill the regulatory requirements and then also scale up better in the healthcare settings. So this is the so-called challenge of reproducibility of clinical prediction models, which is currently not there. Currently, most results that are obtained in research settings do not translate into the clinical practice, and this is what this infrastructure is targeting to address. And then, as such, we expect that in a longer term, this infrastructure will have impact on clinical pathways in radiology and in oncology. Next slide, please. So here you can see some relevant targets that were identified for the first 4 years of this effort. So these include the number of hospitals and imaging data repositories that will be linked to the infrastructure. The project started with 21 clinical sites from 12 countries, and it aims to have at least 30 distributed data providers from 15 countries by the end of 2026. Also, so new imaging data providers will be joining the project in the course of this year. And there also will be other actions targeting, in particular, cancer screening data, which will be launched and will aim at engaging more data holders who can benefit from AI tools for working with the data and also provide data to the infrastructure. Another KPI that has been identified relates to data types and sizes. So this infrastructure is intended to cover both common cancers such as breast, lung, or prostate, or colorectal cancer, and rare cancers such as ovarian or pediatric cancers. And it is expected that the infrastructure will include more than 100,000 cases by the end of 2026. And then there's also a target relating to the users. At least 300 researchers, healthcare professionals, and innovators from 15 countries are expected to use this platform in operational mode by the end of 2026. Next slide. So this project that deploys the infrastructure has now been ongoing for 18 months, and now in June 2024 has reached the next important milestone with the release of the interim version of the platform, which you can see under the address given at the bottom of the of the page. What is available now, what you can see is a searchable public catalog, which allows you to search for the data in an organized way. There is also a dashboard where you can find the graphical representation of the available data sets. And currently, in terms of data, the platform catalogs 46 data sets of 8 different cancer types and over 35,000 subjects. This data is not yet, cannot yet be requested through the platform to obtain the access you need to contact the data providers. But as a next step, there will be a mechanism to request data through the platform. Behind the scenes, obviously, there are further functionalities that are being deployed, and also the work on the governance structure is progressing. Next slide, please. So in terms of the overall timeline, I said now currently we have a 4-year project that is being funded from the Digital Europe program, and the functionalities are being extended now in this year 2024. Also, the number of data sets that are available in the catalog is increasing. And the first full version of the platform, which will also include a benchmarking platform, will be released by the end of this year, 2024. Also, by the end of this year, the consortium internal data providers will be connected, will be providing their data through the infrastructure, and new project partners will be federating their data sets into the infrastructure in the course of next year, 2025. And also by the end of that year, the digital infrastructure will be fully operational. And the last year of the funded project, 2026, this is where we expect that the digital infrastructure will be fully operational and running. And that year, 2026, will also involve the piloting of the business model. Next slide. As regards the long-term sustainability, also here the consortium is working toward establishing a European digital infrastructure consortium. This model is considered the most suitable to deliver on the goals of this multi-country digital project. And so this infrastructure envisaged to become a federated data infrastructure that will enable secure access to quality cancer imaging data and related clinical information that is ready to be used for the development and benchmarking of AI-based cancer management tools towards precision medicine. And here again, it's important to say that this will not only address the researchers that are working on cancer in the context of research projects with imaging data. What is important to say that here the researchers, industry and clinicians, they will be designing and running observational studies at hospitals and building reproducible image-based decision support models in oncology, which can later be then brought through the regulatory approval to then the clinical practice and benefit cancer patients. So these tools and services of the platform will also help make the best use of AI in the context of cancer screening programs. And finally, this infrastructure is targeted to help those data holders who have the right, the obligation or capability to make certain data available for research purposes to comply with the GDPR and also the upcoming European Health Data Space regulation that was explained earlier. And what is important and what Szymon talked about, that being an EDIC will allow Cancer Image Europe to act as an authorized participant in the context of this EHDS framework. Here we are perhaps a bit less advanced than the genomic EDIC. So here a working group has been established last year and among the member states, and which is now working on defining the scope, the governance structure and the financial model for the EDIC, and then prepare the application for the European Commission. A number of countries listed on the slides are involved, and also the work towards engaging more countries is ongoing. So with this, I think this is my last slide, so I hand back.
Thank you very much. Thank you to all colleagues as well who contributed to today's very interesting presentation. In the interest of time, we'll only select a few questions and answers from the audience, but we will aim to address them in writing. So then we'll post them on the shared platform with the slides. So we have collected a few from Slido. I think one popular one was the following: how are low literate digital users taken into account? And I believe that might be directed to you, Renate, and or Saila.
I would say maybe Konstantin could take this one, if that's okay.
Oh, sure.
Yeah, sure, I can take this one. So the EHDS regulation has a specific article on digital health literacy and digital health access. And in addition, digital health authorities are tasked with some relevant duties, such as, for instance, to take into account persons with disabilities to exercise their rights. In my presentation, I mentioned one of the rights of the natural persons in the context of primary use of the HDS regulation, that is to authorize somebody else to access data on their behalf. So that might be very useful for people who are not entirely fluent in in the digital domains. They might authorize somebody to help them in this digital health universe. And also, going back to Renata's presentation, in the digital decade e-health indicator, there is accessibility as one of the sub-indicators of this composite indicator. And there is also a question on the support for people who have difficulties in using online health data access services. So there are multiple instruments in play here.
Thank you very much. Another question that also seemed to gather a lot of votes was how do opt-out and consent, more an opt-in mechanism, work together? So perhaps one of the colleagues could perhaps take this one, Konstantin or Owen, I believe. Owen, yeah?
Yes, I can take that one. Maybe here's a bit of a, noise in the office, bit of background on how these things came up from the proposal, and particularly now on the secondary use side. So in the proposal, we had neither opt-in or opt-out. So the data would be made available. It would be a legal obligation on the holders to make data available in reply to a permit decision. Again, very important, not the raw data, but anonymized or pseudonymized. So it would never be the case that a user would know, okay, this is the person that data or entry in the data set relates to. It would always be, at the very least, pseudonymized, and there are quite long, and there are strict prohibitions against trying to re-identify them. So that was the starting point, and also in the since obviously this was a text with quite some data protection implications, it went to the European Data Protection Supervisor and the European Data Protection Board for their comments. They had several suggestions for improvement, but they decidedly did not call for an opt-out or opt-in approach here. Because what we're doing with the safeguards around secondary use, convince them that yes, given the possible users here, this would be justified to have neither of those two. So that was in a way the legal view on the matter. Now in the political discussions later on, there was indeed a very strong push for an opt-out from the parliament side. And well, the outcome is that indeed now we do have an opt-out for secondary use. I mean, so other things on primary use, but since the question was about secondary use, I'll focus on that. An opt-out for secondary use in the political outcome, which on our side, it is the co-legislator's decision to include that. But we do see that it will cause some less representativity in the data sets. So that was also the very same reason why we didn't propose that in the first place in the proposal, but that is the outcome. So that's the outcome. That's what we're going to build. On why no opt-in, all the problems on data representativity that you have with an opt-out, you have even more with an opt-in. And the other point is that opt-in research, including on completely raw data, is perfectly possible now already. You can go and ask people for their consent to a certain to making their data available and a specific research project. So the answer is, in a way, if we had gone for opt-in, there would have been no point in having another, a new legal proposal on this. So that, in a way, is why we didn't have opt-out in the proposal, and the story on how it came in now. Maybe, and sorry for talking so long on this, one last thing here, which is also quite important, because often people mix up the different consents in medicine, and also so there's one thing is consent to a medical procedure. Before you have an operation, the doctors inform you about the medical reasons behind it, the risks, and then you do the medical consent, which makes the difference between a medical information and a knife attack, so to say, legally speaking. That's one thing. That indeed is there. Almost all medical things are consent-based. The other thing is about the processing of data behind that. And there, of course, doctors are obliged to document the treatment that they provide. They are also obliged to notify certain things, for example, notifiable diseases to public health authorities. That is also not consent-based. So there is plenty of non-consent-based users in the health system already. So in that sense, what we're doing now here is nothing out of the ordinary. Also, because we didn't have that much time in the presentation, of course, what we're doing here is not something that we pulled out of thin air. It's inspired by what some of the member states who are more advanced in this field, such as the Finns and the French and the Danes are. And there you also have no opt-in solution, but rather, as I explained earlier, via the safeguards. That the safeguards actually make sure that this can be done in a safe and secure way, so that there is, in that sense, nothing to worry about for the patient side, because everything will be very robustly pseudonymized or anonymized on this. And my answer here. Thank you.
Thank you very much for this. So just maybe to wrap up, one final round of questions, which will go to Maya. So from our audience, there are some countries whose major institutions don't share data. Will they need to be convinced to add the data in the wallets for citizen access? Then another question was, have you seen the wallet work in action? What are the initial responses to it? And then perhaps you might want to take a minute to answer, what's the advantage of using the e-wallet for private leisure documents like train tickets? That's very practical. Would it not be a duplication of the current train application? So thank you very much, Maya, if you don't mind taking the floor.
Yes, sure, no problem. So in the first one, and then there be the obligation to share data. In fact, what happens is that an EUDI wallet, to really be an EUDI wallet, needs to have certain identity information on board on that. And this needs to come from the member state governments. And as they will have the obligation to offer citizens, there's basic user information that needs to be onboarded. I mean, this is a requirement. This is a no-go. There's also obligation to accept in the public sector the wallet for authentication of users. And apart from that, in fact, it's the sector in the end which decide what is the information that they want to use, in what form. And when I'm talking about the credentials, it's let's say it's the use case in the end is in a cross-border situation. It's configured by the sector. So the answer is, in principle, there is no need to convince, because basic information for identity needs to be in the wallet by the regulation. On the second one, on the how the wallet work in action. In fact, there's still 2 years, more than 2 years, for the obligation to be in place for member states. We are working with member states now on the not only on the developments, but on the implementing acts, on how it needs to be in fact developed and configured. So we see a lot of interest, of course, because the regulation it's adopted, entering in force, and they need to start working on the development of the wallet. And what is the advantage of using the wallet for private leisure documents as such a trading? In fact, there will be some cases that if you also develop a use case around a situation whenever you have another application that covers that, it can be a duplication. In principle, we think that it's more convenient for the user to have everything in one place, but of course we don't expect that everything goes to the UDA wallet. There will be other applications that will live together with the wallet, but anyhow, it is also an option to have that kind of documents in the wallet.
All right, thank you so much. Thank you, Maya. And well, I'd like to thank everyone once again, to you colleagues, for all your very interesting presentations and for your time, and also for our very interested audience and very informative session indeed for all of us, I'm sure. So we've seen in a number of ways how the digital transformation can make a reality of things more concrete to many people. And not just at the end of the decade, but also right now. But we also imagine and see now that it relies on many different activities which you all presented, including the opportunities and the challenges related to digital health, the challenges of not harnessing the power of health data. We also saw how the Digital Europe program provides supports to deploy health infrastructure, such as for genomic data and virtual twins. And then we went through e-health as a key target of the Digital Decade Policy Program, and the importance of an equitable access to all EU member states and Europeans, to have, for instance, your lab results, your e-prescriptions, your patient summary in one register through the electronic health records. And then we've also, of course, went through this European Digital Identity Wallet as a free, secure, and accepted means, an interoperable way, and very handy for people and businesses across the EU. The ecosystem around it, the interactions, the roles, the responsibilities, and also you presented some very concrete cases which really show how that change could be meaningful again in our daily lives. And then we went through the European health data space as also one of the key EU regulations in the health space, the architecture, the timeline, the safeguards. And then we ended with, last but not least, again, the European Digital Infrastructure Consortia as part of the Digital Decade program as well. Just to remind everyone that our next report, the 2024 State of the Digital Decade report, is coming up on June 26th, so very soon. So we hope that you will stay tuned, and we will see you all after the summer, because as my colleagues mentioned at the start, we will have a Connect University session, so in September, this time to really make the connection between the impact, the digital technologies and their impact on mental health. So thank you very much to all of you for keeping following this community, and we look forward to seeing you after the summer. Thank you.